Hi, my name is Carl Freeman, student nurse at Miles Community College. Today we will be mixing insulin and giving it an injection to a patient via subcutaneous route. First thing to go through is the 6 rights of medication administration. Right patient, right drug, right dose, right route, right time, and right documentation. We will document the medication has been given once it has been given. Here we have the physician orders that have been verified by the student nurse. As you can see, they've been time dated, initialed, and read back. And they have been compared with the MAR. We have our NPH insulin. The doctor has ordered 20 units of NPH, and the doctor has ordered a sliding scale regular insulin based off the patient's glucose. The patient's glucose at 0700 was 245. So based on the doctor's order, we will have 10 units. So just to verify, that's 20 units of NPH and 10 units of regular. We're going to make sure we have the right needle. U100 insulin syringe. These vials are already open, but we have verified that they are not old by checking the time and date that they were opened. We're going to start by opening an alcohol pad. And washing or wiping the top of both vials. Next step is we're going to uncap the needle. We're going to place the cap upside down to make it easier for capping. We're going to draw back We're going to draw back 10, 20, 30 units, of air. We are going to put 20 units of air into the NPH. Bring us to 10 units of air left. And we're going to inject that into the regular. We're then going to bring our regular upside down at a 90-degree angle. And we're going to draw back 10 units. We are going to insert our syringe into the NPH, turn it upside down at a 90-degree angle, and we are going to bring out 20 more units for a total of 30. We are then going to recap our needle without touching it. We're going to enter the patient's room. We're going to wash our hands and apply gloves. We're going to talk to Mr. Rocker, and we're going to ask him for his name and date of birth. This will give us 2 patient identifiers that we need to verify that we have the right patient that is going to receive the medication. We're going to ask if he has any allergies. It says in his chart that he's allergic to Celebrix, so we're going to verify that and ask him if there's any more. The patient has asked that the injection be put into the lower left-hand quadrant of his stomach, so we're going to comply with that. We're going to take an alcohol swab, and we are going to start with small circles and bring them outward, making sure that the site is clean. Now I have prepared this dose of medication, but I need to verify it with another nurse.
That is correct.
I'm going to uncap the needle. I'm going to pinch the skin of the stomach. I'm going to hold it like a dart and inject the needle. I am then going to slowly inject the insulin because there is nothing in my path. I am not going to recap the needle. I'm going to bring it straight to the sharps container. I'm going to sign the MAR stating that I gave the medication. I'm going to ask Mr. Rocker if he has any questions. And that is it. Thank you.